Hi everyone, Dr. Ellie here with the iHealKids podcast. I'm the founder of Middle Path Integrative Pediatrics in Asheville, North Carolina. I also serve people throughout North Carolina, California, South Carolina, and Florida for functional medicine consulting. So check that out as well on my website, middlepathintegrativepediatrics.com. Well, I'm here today on a podcast that's been inspired by my patients. So for whatever reason right now, I have a lot of infants in my practice. And infants, for those of you that don't know or may have forgotten, do some really weird things. And a lot of them can be normal, but also really concerning. And so I just want to demystify all of that for you guys and make sure that you guys know when to be worried and when not to be. And of course, this is educational, so should not be construed as medical advice. So please reach out to your local provider. And if you have any questions, definitely make sure you're getting medical advice. Okay, let's talk about common health concerns. Okay, there's a lot, so we can't cover everything today, but I do want to touch on just a few things. Cradle cap. Okay, let's start with that. So cradle cap is when babies sort of get this oily, scaly, could be yellow, could be a little bit whitish, flaking on their scalp. It can also be present in the eyebrows. And, it can be alarming if you've never seen something like that before. Like, what is that? Usually that's cradle cap. And it's not harmful to your baby. They're not in pain. Nothing bad will happen because they have that. And to treat it, all you need to do is just go ahead and wash the scalp with just a mild, fragrance-free, low toxin shampoo. And then go ahead and massage with olive oil or coconut oil to kind of help loosen the scales. And if it's too oily, you can actually do that prior to washing. So just kind of massage it to loosen the scales, wash, and then use a baby brush. Some people do it the other way around because they feel like it's easier to take the scales off after the oil's been applied. But either way that you want to do that is fine. And another thing that can really help, if you are a breastfeeding parent, go ahead and make sure your diet is enriched with omega-3 fatty acids. So things like fatty fish, which is salmon, sardines, and mackerel, 2 portions a week. Or you could just take like a supplement if you don't find fish palatable. So that would be another way to do it. All right. So let's talk about baby acne. This is another one that I think is a little alarming if you're not aware that your baby might get acne, right? Because normally you might think about that as like a teenage thing or something like that. And here you are seeing kind of little spots on your baby's face and you're like, oh my gosh, what is going on? Well, babies can get acne as well. And it's also to do with the birthing parent's hormones creating the issue. And so it's nothing to worry about. It'll go away on its own. Just go ahead and bathe your baby per usual. And don't panic. Of course, if you were worried about any of it or thinking something, is infected, then definitely bring it to your pediatrician's attention or mine. Okay. There's so much I can say about diaper rash, but generally, there's more than I can say than 2 things, but I'll just say 2 things about diaper rash. Well, I'll talk about the 2 types of diaper rash. Okay. Although there's more types. I'll talk about the 2 main types of diaper rash. Let me try and spit that out. So one of them is an irritant diaper rash, and that's simply from, most of the time, the urine getting trapped next to the skin of the baby and causing irritation, hence the name irritant, and it'll be kind of reddish color, they'll look inflamed, just basically your baby's bottom is going to be kind of red in the location of the diaper. And a lot of people sort of worry because they're like, oh my gosh, I change my baby's diaper all the time and it's still happening. Baby skin is very sensitive, so it may not be that you're doing something wrong. It just may mean that your baby has really sensitive skin. So that being the case, as much as you can, try to take your baby out of the diaper. And this generally makes people absolutely nuts when I recommend this because they're like, well, then what do I do? So as much as you possibly can, if there's a really bad diaper rash, you can put down like the potty pads, like the little puppies use. If you have an older child, like a toddler, you can let them run around outside, all of that. You just want to get air to the area as much as possible. Obviously, that's not possible all the time. And so what do we do if we can't do that? So the next thing we want to do is a barrier cream. So barrier cream is really simple. It just makes a barrier on the skin so that the urine can't touch the skin of the diaper. And you can use, natural barrier creams like a coconut or shea butter type diaper cream. Or sometimes if that's not quite strong enough, you may even want to use something with zinc oxide. Now, a lot of people are scared of chemical names, and I completely get that because we're all trying to avoid toxin nowadays. But zinc oxide is one of those things that it doesn't absorb into the skin and bloodstream. So it actually lays on top of the skin and creates like a really thick barrier. And it's meant to stick to the skin, and it's meant to protect from diaper rash. And word of caution when using anything with zinc oxide, because it is meant to strongly adhere to the skin, if you are a person who is very vigilant about wiping every last bit of zinc oxide cream off your baby's bottom before reapplying to help with diaper rash, it may actually be making the situation worse. So people always look at me like I'm a little nuts when I say that, but imagine if you have something irritated and then you put a cream over it and now you're scrubbing. So, that can really make the skin feel worse. So make sure if you're using a zinc oxide cream, apply it all in the area needed, the diaper area. And then if the baby poops or urinates, wipe off the poop and urination, the urine, and also whatever cream comes off with that. Now, if there's little pieces still kind of left on there, assuming they're, have been wiped, leave them there. Then reapply the zinc oxide, and then do that with each diaper change if it's a really bad rash. Another type of diaper rash that commonly happens with babies is fungal rashes. So candida, really common just because of the moisture in the diaper. The yeast can grow and it can cause almost these little sort of red dots all over the baby's bottom, the vulva, the penis scrotum, you name it. Anywhere in that diaper area, you can see these little yeast colonies. And there are things that you can do at home. You could use a natural antifungal cream such as calendula. However, if that's not something that's working, we could do just a topical nystatin, which is a pharmaceutical anti-yeast. It's not an antibiotic. It doesn't absorb into the baby's system, and that can help clear up that rash as well. So if you feel like you have a fungal rash that's not going away with that calendula and aeration alone, you may want to reach out for that anti-yeast cream. Lastly, if you're having a rash that's really not going well, there could be other things. It could be actually the dye in the diaper. It could be that brand of diaper that your baby's allergic to. There could be a food sensitivity, other things to think about. So definitely let us know. Okay, umbilical cords. What could be more weird than an umbilical cord still attached to your belly button? If you've never seen that before, they do look a little different. I mean, how do you even know how to take care of this thing? Well, just keep in mind that it does need to completely dry before it falls off. So it can look kind of shrivelly, kind of gray, pretty funky. And then usually in 1 to 3 weeks after birth, it will fall off. The main thing to remember with this is, you guys, it used to be like back in the day, people would put like alcohol on there, all kinds of different things to try and like make it dry or stay sterile, all of that. You don't need to do any of that. Just make sure that the stump is exposed to the air. So, roll down the diaper to make sure that area isn't covered. And then that will help that area dry out and then fall off. Some people even have fancy diapers where they have like the little piece cut out, or you can just take some scissors and cut out that little piece if you want to. Folding down the diaper works really well too. Okay, so like I said, we're not doing the alcohol anymore. We're not putting stuff on the stump. You may actually see some clear or blood-tinged fluid. If you notice anything like that, just kind of take a little cotton swab, wipe it off. Nothing really crazy to do about that. But let us know if, God forbid, you are seeing pus or redness around the belly button itself, umbilicus, or if anything concerns you. I just rather take a look at it and make sure that everything's fine. Another point is, people are like, well, when can I bath my baby? really do want to wait while your baby still has their umbilical stump, because obviously you want to keep it dry. So if we're bathing, then we're kind of going the other way with that. And then it's getting a little bit wet and it may not, dry or fall off as it should. So just sponge bath so you can, bath with a little sponge around that area if your baby does need refreshing. Okay, gas. Babies are hella gassy. They're so gassy. Sometimes you may even think that as an adult in your life that is producing the gas and it ends up being your newborn. A couple things you can do. Burp your baby during feeding, so not, swallowing air and not getting that out. Massaging your baby. One thing you can do is you can lay your baby on their belly across your lap while you're awake and they're awake. Don't do this if you're tired. And just massage their back after feeding. And that can really help kind of get some of that air out as well. You can put the baby down on your forearm to kind of help relieve gas pressure. If you need help learning how to do that, ask your pediatrician because it can be a little tricky. You can cycle your baby's legs. You can massage their belly clockwise. And then, like we talked about before, adjusting the birthing parents or chest feeding parents' diet may help too. So some of this gas-producing foods, eliminating broccoli and onion and all kinds of stuff, that can help as well. There's also a product called Windy that helps relieve gas. It's sort of like a hollow tube. And it stimulates the baby's anal sphincter and it helps them, relieve that gas that's trapped. And a lot of people really do find it helpful. Last, you can use little gas drops as well. They sell those over the counter, simethicone, or gripe water. And you can even make a gripe water at home with fennel seeds and things like that. But they sell many different kinds of proprietary blends. And for the best one, talk to me. Okay. Little baby girls with vaginal discharge. Now, this can be really alarming for people because, of course, most of us don't expect our babies to have any kind of vaginal discharge. In fact, we wouldn't expect them, if we didn't know better, to have any kind of discharge until they were much older, like if they were getting a period or something when they're a teenager. But really, in the first few days after birth, you can get a kind of blood-tinged, mucousy discharge from the vagina. And that's secondary to or caused by the maternal estrogen withdrawal. So don't panic if you see that. That tends to go away on its own first few weeks of life. Another thing people can see is something that's colloquially known as brick dust. And this is uric acid crystals. So uric acid crystals can look a lot like blood, but increased urinary acid excretion can be normal in infants. We do want to make sure that they're eating well, though, having said that, and not getting dehydrated. Breast development, breast buds in newborns. Okay, so this is normal in many babies, boy or girl, to get little swollen areas under the nipples or breast buds. And it'll feel kind of firm or like a little lump or bump. And that's just because of the passage of the birthing parent's estrogen through the placenta. And that can cause swollen breasts for 2 to 4 weeks. And in breastfed babies, it can last even longer, like 6 months. I think the oldest baby I've ever seen was maybe 12 months, but it was starting to go away by then. Okay, what to know about this? Don't ever massage them or squeeze them. Just let those breast buds be. You don't need to do anything to them. They'll go away on their own. You just don't want to do that kind of stuff because it could cause an infection. So just kind of leave those be. Also, this is weird. Newborns can have a little bit of leakage, milky discharge from the nipple as well, which I know would be shocking to see. And it's also normal and it can last a few weeks. And that's also from that maternal estrogen. So don't panic if you're seeing that. Of course, if you're seeing pus or discharge that's not that, or it's going on, longer than we'd expect, I would want to know about that. Baby breathing. Okay. So babies breathe way fast. So they're breathing 40 to 60 breaths per minute. It can slow to 30 to 40 breaths per minute while sleeping. And here's the weird thing. Newborns, or I guess weirder thing, newborns can have periodic breathing. And so what does that mean? Okay. This inevitably, you're going to notice at 2 a.m. and go to the ER. Please don't. Well, you can. I mean, if you're worried, please do. But this is normal. So periodic breathing. So they breathe rapidly for a very short period of time, and then they'll pause for 5 to 10 seconds And then they'll start breathing again. And you're like, oh my gosh, like, did my baby, completely stop breathing? And as long as it's not lasting more than 20 seconds, they start breathing again, they're not turning blue, they don't look otherwise sick or in distress, this is normal. So that's periodic breathing of the newborn. And it's more common in premature babies. Premature babies, though, sometimes need a little help with this, but the NICU doctor, the neonatologist, would let you know if there was anything else you needed to do before you got discharged. So just be aware of that. When is breathing an issue other than what I talked about before? Okay, if you're hearing weird whistle sounds, grunting sounds, wheezing, they're turning blue, they're sucking in under their rib cage to breathe, they look like they're in distress, they're breathing faster than 60 breaths per minute, they're sick, their pauses are lasting a long time, those are signs for concern. So then you'll need to reach out either to, depending on the level of concern, either 911 ER or your pediatrician. So definitely discuss those with somebody. All right, I want to talk about fontanelles. So fontanelles are the little soft spots on babies, and you can have the one on the top of their head and the one on the back of their head, and that's the anterior and posterior fontanelles. And I get a lot of calls from parents because, one, they see their little fontanelle, their soft spot, moving. And obviously that's alarming to people, because if my head started moving, I would be going to the emergency room. But in babies, you can actually see a soft or moving soft spot, a pulsating soft spot. And that's because it just reflects the pulsing of the blood beneath the skin. And so you're seeing it corresponding to the baby's heartbeat. And that's really nothing to worry about. Another thing I get a question about all the time with soft spots is, when do they go away? So the anterior one is usually around 12 months. And posterior one is a lot sooner, 1 to 2 months, somewhere in there. Also, if your baby has a sunken or bulging soft spot, there's a ton of stuff on the internet about that. Sunken can mean dehydrated, and bulging can mean that there's an infection. I have never actually seen this in practice. Maybe it's because I'm more of a general pediatrician, and there may be people in the emergency department or NICU or something that's seeing babies with higher acuity. But most of the time when I see the babies, parents aren't waiting until their babies are so sick that those signs are happening. So if you do have concerns, reach out about that, but I don't see those very often. Okay, when the heck should you call the pediatrician? Well, other than the things we've already talked about, if your baby has a fever. So first of all, if you think your baby has a fever, please unbundle them a little bit. Some babies do get overbundled, and they're hot and they're sweaty and they're, they've just pooped and like they're just overheated. They may not have a fever. So just kind of unbundle them, let them kind of sit for a little bit, not forever, but a few minutes just to kind of aerate. And then you do want to take a temperature with a rectal thermometer. So that's the most accurate way to take a temperature in a newborn. And the reason that we want to use the most accurate way is because a fever, which is 100.4 Fahrenheit or 38 C or higher in a newborn, is an emergency. So if you don't have a fever, we really want to know. So, if it's 99 or 99.5, that makes a big difference for a newborn versus 100.4 or 38. And it can actually even mean the difference between blood tests and urine tests and, God forbid, spinal taps and things like that in what your doctor needs to do to make sure your baby's okay. So if you are worried there's a fever, do take that rectal temp. If you are seeing that temperature, middle of the night, something like that, you need to go to the emergency. There are things that newborns can get that are really concerning at this age. And so you need to make sure that they are getting checked right away. Okay, so 2 months and under, fever is an emergency. Some people would argue 2 to 3 months. Any questions about that, definitely reach out to a doctor. Okay. All right. When else do you want to call your pediatrician? If your baby's not feeding well, if they're not pooping well, they're not urinating well, if they don't seem to want to wake up to feed consistently, they're coughing and choking on feeds, those are reasons to definitely reach out. The forceful vomiting, the green colored vomiting, blood in the vomit, blood in the poop, please let us know. And really, you guys, if intuitively your baby just feels very, very sick to you, reach out, because most people just kind of have that gut feeling when something's wrong. And I would much rather see you in the office and, have a discussion that hopefully ends in me just reassuring you. Never feel bad about going in to just get that second opinion and make sure everything's fine. But fever, difficulty breathing, not eating well, not urinating well, those are a lot more concerning, as well as those bloody vomits, bilious vomits, poops, things like that. So I hope this was helpful. Babies do a lot of very strange things. And I hope that some of you sleep a little bit better at night. If you need any further advice and you are in Asheville, North Carolina, and you'd like to join Middle Path Integrative Pediatrics, please go on my website, because I do have a link that says Meet the Doctor. I think it says Meet the Doctor. Maybe it says free meet and greet. But it's very easy to find, and you can sign up and schedule a complimentary meet and greet and see if we are a good fit for each other. And I would love to do that and see you in my practice. Additionally, if you need a functional medicine consult, ages 2 to 102, I would be happy to see you for that as well. So go to www.middlepathintegrativepediatrics.com and I'll see you there. Wishing you well. Bye, guys.